Hi everyone. So I think it should be live now. Just wait a few seconds just to let people have the time to join on. So happy Wednesday. I hope you guys are out, have been out enjoying the sunshine. So today we're going to be talking about cardiovascular emergencies. Um, we're going to talk specifically about two in particular, and then just looking at what can cause them, what warning signs you're looking for, and what to do in the case of one of these emergencies. And then after we do that, we're gonna make a first aid box for your house or for your car, wherever you feel that you need it most. So that's the plan for today. So I'll just hopefully you guys can hear me. Everything is working properly, and then so we can get started and get into. Okay. So essentially, to start, cardiovascular emergencies are life-threatening disorders that need to be recognized right away to avoid delays in treatment and to minimize the morbidity or mortality, so the risk of death or impairment or disease. Okay, great. Thanks for the comment. Um, to minimize the risk, essentially. So the ones that we're going to be talking about or focusing on today are heart attacks and strokes. So the first one is heart attack. So a heart attack essentially occurs when the blood supply to a part of your heart muscle is severely reduced or stopped because of a blockage of some sort, and that will result in damage to that part of the heart. So, most heart attacks are caused by a blockage to one or more of what's called coronary arteries. And these are the arteries that bring blood and oxygen to the heart. And most of the time, these blockages are caused by a blood clot. So, you've likely seen the scenes in movies or TV of someone like clutching their chest, falling to the ground. And although some heart attacks can be dramatic like this, most aren't essentially like that fictional portrayal. A lot of the time, people will experience symptoms that aren't quite as obvious. Um, in fact, many people who have a heart attack will suffer, like a lot of people can suffer from permanent heart damage simply because they don't get help quickly enough, because they don't recognize the symptoms, or they don't think that the symptoms are severe enough to warrant emergency assistance. And heart attack symptoms can really vary from person to person. Some people might not even have any symptoms, and because of that, they would likely not seek treatment, and then that delay in treatment is an issue for morbidity or mortality. So the term heart attack is a more common or colloquial term for myocardial infarction. So if you ever heard terms like myocardial infarction, STEMI, which is ST segment elevation myocardial infarction, or non-STEMI, where there's no ST elevation, but it's a myocardial infarction. These are all essentially just medical terms that mean different types of heart attack. And so the word myocardial infarction, if you can separate it into myocardium refers to heart muscles, and infarction means dead tissue because of a lack of oxygen. So now that we know some of the medical terms and how it happens, it's important to discuss some of the symptoms and warning signs to look for. So the main symptoms and warning signs of a heart attack are chest pain, tightness, like discomfort or crushing sensation in the chest, a heaviness, pressure, or squeezing in the chest, or even a fullness or burning. So sometimes a heart attack can mimic similar symptoms to like acid reflux. So if you're someone who has acid reflux, it's important to, well, hopefully control that acid reflux, but also note that sometimes the symptoms of a heart attack can mimic things like GERD or acid reflux symptoms as well. So that's the chest symptoms, so either tightness, discomfort, crush, heaviness, fullness, or burning. Another thing would be pain from the center of your chest that's going to spread down one or both arms. So usually it's going to spread down the left arm. Particularly in men, they'll note that these symptoms coming into their arm, but you can also have it down both arms or even up into your neck, jaw, shoulders, and in your back. So the pain, because of certain receptors and pain receptors that you have in your heart, or nerves essentially, these nerves will come up and they come actually up into your neck. And then these nerves can also feed into your arms. So that's why you're going to have some symptoms that will it's called radiation of pain. So radiating from the chest into other parts of your body. So those are kind of two of the common signs. Other signs that you can have are shortness of breath, where you feel like it's difficult to take a deep breath, or you're breathing more shallow, hard to breathe, breathlessness. It can feel a little bit different for everyone. Paleness, sweating, or just weakness. So oftentimes people will note that they just start sweating, particularly out of the blue, or when they might not be sweating normally. Nausea or vomiting, or symptoms of indigestion is another one. Anxiety or fear can be one as well. Like some people describe an impending sense of doom. And what that really means is just the real feeling that something is not right, that anxiety. Or on the opposite hand, like I said, symptoms can really vary from person to person. Some people will have more of a denial. So denial, refusing to admit that anything is wrong, just have the sensation that it's fine. We're like denying the symptoms that you're feeling. So all those together are definitely the common symptoms of heart attack. In the literature and research, heart attack is often like more studied in males. And so newer research is coming out and showing that the symptoms can be different in women than they are for men, and they might not have those obvious symptoms that men sometimes present with, like that crushing chest pain. And they might feel more indigestion, like just discomfort, a vague chest pressure, nausea, or back pain. Women in particular will identify pain in the back of the jaw as well. So in the back as well as back of your jaw, and then just overall discomfort. Because the signs and symptoms for heart attacks in women are a lot more vague, it's really important that women and their doctors too do not ignore some of those more easy to miss symptoms. And if you feel like something is wrong, it's important to seek medical advice and medical treatment. If you notice any of the signs that I was talking about before, don't delay. Consult your doctor immediately or go to the emergency room, because the longer an artery stays blocked, the more damage that it can cause. Don't drive yourself to the hospital. Either call 911, or if someone else is with you, have them drive you. Delays in the early phases of a heart attack can significantly reduce the chances of survival, but on average, Canadians wait almost 5 hours before getting help. So it's really important to recognize the signs and symptoms and respond immediately. So while some of the risk factors for heart disease can't be altered, others can be modified by lifestyle changes, some of the things that we've talked about in our previous lives. So some of the risk factors that you can't change are age and family history. But the things you can change are controlling smoking, so stopping smoking, reducing your high blood pressure with things like yoga and meditation that we did last week, or medications, lifestyle changes, reducing stress, um, reducing your bad cholesterol. So LDL is bad cholesterol. You can increase your physical activity, control diabetes, and reduce your weight. Once you've had a heart attack, treatment for heart attacks can include certain medications like anticoagulant drugs, which are essentially drugs that prevent clots from forming, thrombolytic drugs, which are known as clot busters or clot dissolvers that will dissolve the clot that is blocking your artery, drugs to lower your blood pressure or reduce your heart rate. You can also have nitroglycerin, which can come in patches or sprays that will relax the blood vessels if you're having symptoms after your heart attack. And then also cholesterol lowering drugs like statins to keep your cholesterol level down to prevent future issues. So sometimes too, the heart attack treatment can involve things like surgery, like angioplasty, or things that will open up that coronary artery that's been blocked. So in a nutshell, that is heart attack. If you have any questions, feel free to submit them in the chat. I'll try my best to answer. But the next one that we're going to talk about is stroke. So that's another common cardiovascular emergency. And a stroke occurs when the blood supply to a part of your brain is interrupted or reduced, which, similar to a heart attack, preventing the oxygen from getting to your heart will prevent the oxygen from getting to your brain tissue. And then the brain cells can start to die. And that is essentially what causes the signs and symptoms of stroke. There are two main causes of stroke. So the first one is a blocked artery, which is exactly like we were talking about before. But the second one is a leaking or bursting blood vessel, which is also known as a hemorrhagic stroke. So those are kind of the two types of stroke. There's a third, more minor, I guess, type. It's called a transient ischemic attack, which is basically, instead of blocking the oxygen and nutrients to the brain kind of indefinitely or until you seek treatment, it's more of a temporary disruption of blood flow to the brain, and it won't cause lasting symptoms, whereas the symptoms of stroke can persist if treatment is not sought quickly. So a transient ischemic attack is also known as a mini stroke, and it's a temporary period of symptoms that are similar to the ones that you'd have in a stroke, but like I said, don't cause permanent damage. Even if you think you've had a TIA or a transient ischemic attack because your symptoms get better, it's important to seek emergency care. It's not possible to tell if you're having a stroke or a TIA just based on your symptoms. And if you've had a TIA, it means that you might have a partially blocked or narrowed artery that leads to your brain, and it can increase your risk of having a full-blown stroke later. So it's still important to seek medical treatment, even if some of these symptoms I'm going to talk about kind of come and go. If they're abnormal for you, then it's good to go seek medical treatment in an emergency department. Many things can influence your risk of stroke. So treatable stroke risk factors include lifestyle risk factors like being overweight or obese, physically inactive, heavy or binge drinking, or the use of illegal drugs like cocaine or methamphetamine. So eliminating those is important. And then there's also some medical risk factors. So high blood pressure, cigarette smoking or secondhand smoke exposure, high cholesterol, diabetes, obstructive sleep apnea, which is where you stop breathing periodically in the middle of the night, cardiovascular diseases like heart failure, heart defects, heart infections, etc., a family history of stroke, heart attack, or TIA. And then they're also showing that in some cases, COVID-19 infections have increased individuals' risk of stroke. So Those are some kind of modifiable risk factors, medical ones. They're very similar to the ones of heart attack. So reducing those risk factors are good to prevent cardiovascular emergencies in both cases. Just like a heart attack, a stroke is a medical emergency, and prompt treatment is crucial. Early action can reduce the brain damage associated with a stroke and some of the other complications that you can get. So if you are someone that you know is having a stroke, there are certain things that you should particularly look for. The first thing is pay attention to the time the symptoms began, because some treatment options can only be offered in a certain period of time after the stroke symptoms have began. So it's important to kind of note that time and remember it to tell for when the doctors ask you in the future. But there's certain signs of symptoms of stroke that you should look for, like trouble speaking or understanding what other people are saying. So you might experience some confusion, slurring of your words, having difficulty understanding speech. Another one is paralysis or numbness in your face, arm, and leg, particularly usually on one side of the body. So what you can do is try to raise both your arms over your head at the same time. And if one arm starts to fall without you pulling it down, obviously, then you might be having a stroke. The other thing is that one side of your mouth might droop. Particularly when you're trying to smile, you might see kind of one side that's not raising or drooping when you're talking or smiling. Another symptom would be problems seeing in one or both of your eyes. So you could have a sudden blurring of vision or blackened vision in one or both eyes, or you could see double. Another common sign would be headache. But this would be a sudden and severe headache that can be accompanied by vomiting, dizziness, or altered consciousness. If you're routinely someone who gets headaches and it's not abnormal for you, don't be concerned. But if it's sudden onset and severe, something out of the ordinary for you, then you can think maybe stroke. The last one would be trouble walking, so lack of balance, stumbling, sudden dizziness, or lack of coordination can be an indication that you might be having a stroke. So I'll leave you with this acronym that I think is really easy to remember and important for stroke. It's called FAST. So remember to think fast. And so FAST, the F stands for face. So if you think someone is having a heart attack, a stroke, ask the person to smile. Does one side of their face droop? If so, then the F in FAST is pointing towards stroke. The next one is the A for arms. So ask the person to raise both arms. Is one arm drifting downwards, or are they unable to raise one arm? So you can either do it beside your head or ask them to put their arms out in front of them. If one starts to fall, then that could be a sign that they're having a stroke, or if they're not able to raise their arm to the same level, that could be an issue as well. The S in FAST stands for speech, so ask the person to say a simple phrase and see if their speech is slurred or strange, out of the ordinary for them. And then the last one is T, so for time. So if you observe any of these signs, call 911 or get emergency help immediately. So when you're suspecting stroke, think fast. Face, arms, speech, and time. Just like in heart attacks, some women can experience other or more understated symptoms that might cause them to hesitate getting medical attention. So women more frequently have atypical or vague symptoms. It can start with fatigue, confusion, or maybe general weakness, as opposed to that weakness on one side of the body. So it might just be more generalized weakness. It's important to take note of any sudden change or unusual body info, because many women can disregard something like a sudden, unusually bad headache if they're generally used to getting headaches, or they could dismiss difficulty walking exhaustion or brain fog as just, feeling overall badly and blame it on stress or being overworked or, just overtired. Or nausea or vomiting can be explained by a viral illness or having eaten something. So it's critical to kind of zero in on just any sudden symptom or loss in function that you cannot explain. And the key would be here that it's going to be more suddenly onset than something like a gradual increase in kind of nausea or something like that. It might be more sudden. But just to remember that for women in both heart attacks and strokes, it can look a little bit different than what you see in the movies or what's commonly discussed. So those are kind of the two main cardiovascular medical emergencies and some signs to look for and what to do in that case. We'll shift gears a little bit to our activity. So for this one, the most important thing during an emergency is that you're thinking of everything at once. It's usually a very stressful environment and time, so you want to be really prepared ahead of time. A good way to do that is by having this first aid box that we're going to be making today, because a well-stocked first aid kit can help you respond effectively to common injuries or emergencies. It's a good idea to keep one first aid kit in your house and then one in your car, because often, like when you're out, you're not thinking of these things, but it's good to always just keep one with you, particularly in your car in case there's some emergency. A good idea is to store these kits in somewhere easy to get to, out of reach of young kids, because they might have certain things that should not be ingested or can be dangerous. Make sure if you have kids that are old enough to understand the purpose of them, show them where they're stored, and consider taking a first aid course or preparing your children for medical emergencies in an age-appropriate way, of course. I think some of my colleagues have given a CPR lesson in one of their lives, so you can check that out as well. So in terms of first aid kits, you can actually buy them in a drugstore, like a pre-made one, or you can assemble them on your own. So we're going to assemble one on our own today, and the good thing about that is you can tailor your kit based on what you think you need or different activities that you might be doing, and things that are specific to you or your family. And the other thing too is that if you buy some of these things at, for example, the drugstore, they'll often come in larger pack sizes. Like you're probably not going to be able to get a few of this, a few of that. So you can make multiple kits, either one for your car, one for your house, some for your friends, and then it will be more cost effective that way if you can make multiple at one time. So the first important thing is that you're going to need a box. You can either use like a shoe box, something you have. I have a Tupperware here. It doesn't need to be too big, depending on how much you want to put in it. So if you have an old shoe box lying around, you can grab that. The next thing that you might not think of, because you're making the kit kind of for yourself, but there are going to be other people around during a medical emergency, or someone else might need to access it. So it's important to label your box. That way you can tell someone where it is and they can find it really easily. So I grabbed a piece of red paper. You can use any paper you want. And I'm just going to write first aid kit on it. And then the symbol for first aid is that cross. So I'll draw it here. And basically this is just so that perhaps if you're the one having a medical emergency, or if you have anxiety during the medical emergency and you're looking for it, it makes it just more easily identifiable. So first aid kit, and you can attach that just to the lid of the box. I'm just going to do that. Perfect. So now you have a good identifiable first aid kit box. Okay. Now the next thing that you want to do is you want to have, you can grab a paper, and essentially what you want to write on this paper is a list of emergency telephone numbers like 911, but other things like your doctor's office, maybe your pharmacy number, different important medical services that you might want to call in case of an emergency. So even to things like a local poison control center number, just things that you maybe don't want to be looking up in the middle of an emergency that you would like to have on here. So what you can do is you can write it on the paper, and then we can fold the paper. So let's just say doctor, and then their phone number. I'm not going to write any actual numbers, but you could put, number, and then just have a list of those. And what you can do is you can actually fold it in to like a smaller size, maybe like in 4s or something. And then across, you can just write what is inside this list. So if you wanted to say medical numbers, medical emergency numbers, and that way you can easily see it and find the numbers that you need. So you should have one for things like doctor's office, pharmacy, poison control, 911, numbers like that. And then you're going to want to have another one as well with different kind of personal contacts that you would want someone to call in the case of an emergency. So if that is one of your children, if that is a parent, a friend, a neighbor, anyone who can help in the case of an emergency situation. Now, unlike the medical numbers, these ones might be more subject to change. So I would just suggest writing it in pencil, and that way you can switch, erase, edit your emergency contact numbers as many times as you want, and you don't have to keep scratching stuff out and redoing it. And so the same thing with this one with your kind of personal emergency contacts. You can fold it and then write personal contacts. And this is good in case you have maybe like a friend in your house that's helping you that doesn't know who to call, or if an emergency medical professional comes, you can actually just take this and give it to them, and then they'll know who to call once you get to the hospital. They'll have all these numbers handy. So that's pretty good. The other thing you can include is things like medical directives, any like DNR, advanced directives, if you wanted to. Some people don't like to do that just because, you wanted to keep it private. It's up to you. And then the last thing that you want to definitely include in here and update as frequently as you can is a list of your medications, the dosage and schedule, as well as any allergies that you have. So you would, let's say, for example, you take an aspirin, and you could say 81 milligrams, that's a daily baby aspirin, and you could write daily. So just something like this that has the name of your medication, the dosage, and how often you take the medication. Oh, I see a comment here about a health passport. Yeah, that's such a good idea. French and English. Okay, awesome. Yeah, so anything like that that you wanted to throw in, anything is good that you can kind of hand to someone in the case of an emergency so they'll have all this type of information. As well, again, you're going to want to write any allergies that you would have, and these are good to give to paramedics, emergency medical response personnel, or at the hospital to a doctor, so that in the case that if you can't speak for yourself, they'll have this list. And it's very often, or very important to update it frequently. Again, I would suggest writing it in pencil probably, so that you can update it often. And then you can put either the health passport that you have or these papers just into like either a Ziploc bag or an more environmentally friendly method, like with a clip, although you will likely just keep this forever, so you can use it one time. But there are certainly probably other ways to store everything, and then you can just put that in your box. So now that you have all the kind of papers done, there are certain things that you would likely want to include. And this is just a reminder, this is not really an emergency situation first aid kit. So it's not going to have like water, like not an emergency preparedness. It's more of a first aid box. So there's certain things that you're going to want to have in it. So the first thing would be some sterile gauze pads. And you can get them in small and large squares. And they're good to place over larger wounds. So you can see here, you can see these sterile pads. These are larger ones. They usually come in larger packs, like packs of 10. So if you only really need probably 2 or 3 in your box. So again, if you buy a bigger pack, then you can make multiple kits. There's also, so you want to have a couple larger ones and then maybe a couple smaller ones. So you can keep all the adhesive things together, and like I said, you can put them in a Ziploc bag as well. So this would be the first one, the sterile gauze pads. The next thing that you would want would be certain adhesive bandages. So you would want to put a variety of different sizes. You can get some larger ones, some smaller ones. You can put that as well in the Ziploc bag with your sterile pads. The next thing would be an elastic bandage that's more of like a roller, which is good for using as a splint or a dressing. They can also restrict like a body part, or a roller bandage can help slow heavy bleeding out of a more deep cut. So basically you can get them, like this is the box, and it'll come with its own clips, which is good. The best thing to do is, if you have things that are in boxes, in the case of an emergency, the last thing you want to do is be fumbling with a box. So it is good to take out things like these sterile pads from their box, or this roller gauze from the box, but you don't want to have it exposed to the air and become less sterile. So if it's in like a protective covering, you can keep that, but just try to minimize the amount of extra stuff that you'll have to sift through or open in the case of an emergency. So kind of bring it back to the least amount of packaging that you can possibly have without rendering it kind of dirty or not sterile. And then the last thing that you could probably put in this Ziploc bag or case with the kind of adhesive things would be a roll of adhesive tape. And adhesive tape you'll need to hold gauze pads or roller bandages in place. So you can put all those things into maybe a bit of a larger bag and put that into your first aid kit. Or if you don't want to keep them together, you can always, or if you have a more organized box, you can always put, if you have thick cardboard, you can kind of put it inside your box to section it off into smaller compartments. And that's a good way, instead of using Ziploc bags, to kind of compartmentalize the stuff in your box. I don't have any right now, so I'm just going to put it in. But if you did have some thicker cardboard, you could kind of wedge it into your box to section it off. Okay, so the next thing that you would want to have are scissors. So in the case that you need to cut gauze or tape, you want to have a pair of scissors. It can be a small pair. The other thing would be tweezers. And so tweezers are good to remove splinters, or if you need to pull, usually just splinters, because you wouldn't want to pull out like large, if anything is large and lodged into a certain area, the last thing you want to do, likely, although it depends on the advice of the emergency team there, the last thing you want to do is remove it. So, but these tweezers would be good for splinters to remove them. And you probably want to keep the tweezers and scissors in a separate area, or in a Ziploc bag, or in something covering it, so that they stay clean. The next thing that you're gonna want in your box would be an instant ice pack. So if you're at home in your home box, you might not need this because you can have a reusable one in your freezer. But if you're in your car or if you're going camping or if you're somewhere that you are not going to have access to your freezer, you can buy these instant cold compresses. So they're single use. You just snap them, you kind of fold them in half, it snaps the thing on the inside and causes it to become cold. So if you wanted to and you're not at home, you can add one of those in your box as well. Of course, cold compresses are good to alleviate pain, reduce swelling, good to put cold on certain injuries. The next thing that you're gonna want in your box is gloves. And so likely you want to use non-latex gloves because some people have a latex allergy. And so I would suggest putting in 4 gloves. That way you can wear 2 of them if you need to, and if there's someone else with you, that person can wear them as well. And it's important in case there's blood or other bodily fluids to be wearing gloves to protect yourself as the individual who's administering first aid. Okay, the next thing that you're gonna want to have is some type of antiseptic wipe. You can use soap, but there are also alcohol swabs that you can get, and they're good to wipe a cut before you put like a dressing on it. The other thing that I stole all of this from my medicine cabinet just to show you guys. You can use other products too, like this one is an antiseptic spray if you didn't want to use a wipe. There are also, my mom is very well stocked. There is also things like polysporin or different like creams or lotions that are that you can put on that have like an antibiotic ointment. So in terms of antiseptic, it can be like a spray, a swab, and then also for certain cuts, scrapes, cuts and scrapes mostly, you can use like more of an ointment. So it's up to you, whichever versions that you prefer. In that same vein, it's always good to carry, which I'm sure many of us have now because of COVID, some type of hand sanitizer that you can use to disinfect your own hands before you're going to be administering your first aid. So it's good to have that in the box as well. Yeah, the spray is really great actually because then you don't have to touch anything. You can kind of stand back a little bit and use the spray. So yeah, it works really well. Okay, so those are kind of the staple items that you would want in your box. There are other things that are good to have as well. But that might not be as first aid or you might already have. So if you wanted to, you can add something like a thermometer in case you needed to take temperatures, some type of face shield or pocket mask, a pencil and paper. So that's actually a good one to include because it can like allow you, for example, like I said, in the case of stroke, you wanted to record what time the symptoms started. If you have it in your box, like a pencil and a paper, it's good so that you can write down certain information that you don't want to forget during the emergency, and it's just nice to be able to quickly grab it. Now, the other thing is, depending on where you are, where this box is going to be, what you're going to be doing, you can have different things in it like aloe vera gels, calamine lotion, laxatives, antacids, antihistamines if you're maybe out in the woods, and something like Benadryl, cold cough medications, personal medications that don't need to be refrigerated. It's always a good idea if you have anaphylactic allergies to put an extra EpiPen in a first aid box. That way you just have a spare one in case of an emergency. But again, it is important to continuously look at the box. Set like a day for yourself, maybe once every couple of months, to look at it to make sure none of the products that you've put in are expired or need to be replaced. And every time you use something, it's always a good practice to put it back into the box. The last thing, because we were talking about cardiovascular emergencies, I would consider keeping aspirin in your first aid kit. Aspirin can be life-saving in an adult that has chest pain. If you have unexplained chest pain and think you might be having a heart attack, well, first you would call for emergency help immediately, and then the recommendation would often be to chew 2 regular strength aspirin tablets. So it's good to have them on hand in the emergency box if it's not something that you routinely take, just in case the person on the line says chew 2 aspirin tablets. It's always just good to have them handy. However, obviously, don't be taking aspirin if you're allergic to it, have bleeding problems, take other blood thinning meds, or if a doctor has previously told you not to, and never give aspirin to children. It actually can be quite dangerous in children, so save the aspirin for adults and older. I do see a question here. Can you use an ointment that has expired if you haven't replaced it in your box? That's a great question, actually. So from what I understand, it's not going to do any damage. So it would be better than nothing. Likely, if you have nothing else, it's better than nothing. The issue is that after a certain period of time, the active ingredient or the medicinal ingredient will become less and less effective. And so if it's well past its expiry date, you might just be putting on Vaseline, essentially, or petroleum jelly, whatever they use as the base, and it might not be as effective. So I would definitely try to replace it, just because while it might not be dangerous, it might not be as effective. But if you don't have anything else, then it's a fair choice to try it and use it. That's a good question. And then, of course, if there's anything else that you're interested in putting in your box, something specific to you or an issue, like a health issue that you might particularly have, or an issue your children encounter frequently that, like, they're always spraining their ankle, you might want something different in your box, depending on the types of activities that you're doing or your loved ones are doing around you. So yeah, thank you for all your questions. If anyone has any more questions, feel free to put them in the chat. I'll monitor it after this as well. And I'm going to put a list of the things that I put in my box here into the chat as well, because I know we went through it a little bit quickly. And so if you're looking for like the comprehensive list, I will add it in the chat after so that you have a reference to look at. But basically, the general key takeaway from this is that it's important to think ahead, plan ahead when you're not in that emergency situation. And that way, when you are in a more stressful situation, that you're ready to grab the things that you need and are never really taken as by surprise. So yeah, thank you guys for joining. I think I'll see you in 2 weeks. And yeah, watch out for the list in the chat and have a great rest of your week.